Are you a parent navigating the complexities of co-parenting, family court, or even domestic violence? If you are looking for ways to help protect your children and build a strong and supportive community around you, then look no further. Gray Minds Think Alike is your go-to resource for everything related to the complexities of family life. Join us as we dive into thoughtful conversations with experts and explore practical tips and strategies for tackling the challenges of parenthood in the throes of adversity so that no parent feels alone and every child's safety is protected. Hi, everyone, and welcome to Gray Minds Think Alike, where we dive deep into the conversations that matter most, with experts who enlighten, inspire, and empower. In our virtual studio today, we are thrilled to welcome Dr. Leigh Vinocur, a board-certified emergency physician, award-winning medical advisor, and national spokesperson in the media. Dr. Leigh began her groundbreaking medical career as one of the first female urology residents and has since served in the leadership roles including Chief Medical Director, overseeing care for over 150,000 patients annually. Also a pioneer in medical cannabis science and therapeutics, and with over 2 decades in emergency medicine, she's become a trusted voice on TV and media worldwide, from the Dr. Oz Medical Advisory Board to regular appearances on the Today Show, CNN, Fox News, and more. In her new book, Never Let Them See You Sweat: How Science Can Help Harness Stress for Success, Dr. Leigh shares personal stories and tips to empower women by relating to common stressors including motherhood, work-life balance, menopause, cancer, divorce, and much more. She offers practical tools to reduce stress, build resilience, and thrive in life, love, and career, all while reminding us to give ourselves a break when we need it. So without further ado, welcome, Dr. Leigh.
Thank you for having me, Allie. I really appreciate it.
Absolutely. I'm thrilled to talk to you. Like we spoke briefly, I deal with a lot of listeners that are bogged down by stress on a daily basis, and we all know the toll it could take on a person. I know for me personally, dealing with all my stress and grief and anxiety and everything else, I have had those strangest ailments over the last 2 years that I never even thought of people could get. So yeah, I'm excited to dive into all things stress related. And we all have it in some form or another. It's just how we deal with it effectively. If you don't mind, if you can just give our listeners a brief rundown about your career, who you are, and how this became such a hot topic.
You gave them quite the rundown. Thank you very much. And thank you for everything that you do for people related to stress and things like that. You do a really great job. But yeah, I did start out in urology. I was one of the first women that was accepted in the residency. I ended up leaving towards the end of my 4th year. Everyone's, you have 1 more year. What are you doing? In the book, I also talk about you have to be true to yourself. And there were different circumstances that were going on in my life. And I just felt like emergency medicine was something that might have been better for me. And it was very broad based. I love history in college with molecular biology. But taking that change, and I talk about it in the book, and I've seen so many amazing women that I've met through the years, and they get stuck in situations because they're afraid to take that change. And that's what I'm hoping my book will also, besides relieving stress, giving them the courage to say, you can move on, you can fail at things, you just don't have to be afraid, and you have to have some confidence in yourself. And I'm hoping the book will give women some confidence.
I'm sure it will. And I'm sure your work and being in the ER has taught you some key wisdom on how to deal with stress, and it's a very high stress related job. So what have you taken from the medical industry working in the ER in how to deal with stress effectively in your everyday life?
That's where I came up with this idea, never let them see you sweat, because, the last thing you want to come in with a terrible emergency and the emergency physician is freaking out. So you can freak out a little bit on the inside. You got to stay calm, take some breaths. And the truth is, stress is not all that bad, right? It was an evolutionary advantage to keep us safe back in prehistoric times, running from predators.
Right.
Now, maybe this sustained stress isn't good, but in short bursts, whether you're an Olympic runner in the blocks ready to go or standing in the ER, you got the call from the ambulance, what they're bringing in, getting ready with your team to take care of it. You get that pump of adrenaline and it can help you when it's focused. It's just when it's incredibly long and it doesn't end and you feel like there's nothing you can do. It's that sustained stress. In short bursts, it can help us, but the sustained chronic stress can cause all kinds of medical problems, like you said, that people don't realize. It's just not psychological, it's physiological.
Yeah, I'm telling you, my blood pressure is through the roof. I woke up one day and I had a white patch on my skin that took a year to resolve itself. I get eye twitches, just the weirdest thing.
It does. It affects everything. Stress, what happens with stress, the hypothalamus, the pituitary, and the adrenal axis. And we have an area in our brain called the amygdala, which can detect fear and threats and heightened issues. So through that axis, you get sympathetic discharge, which means we have a sympathetic nervous system, parasympathetic. And without getting too technical, the sympathetic is fight or flight, right? And what happens is it causes physiological things. Your eyes dilate, so you get more peripheral vision if you had to run from a predator. All the blood gets diverted from your GI to your muscles. You start breathing faster. It brings more oxygen in. Everything to run and release. But if it's a sustained stress, all of those things happen. We know it can affect your immune system. So you can get infections. How many times have, you're studying when you were a kid in college and you're studying for your finals and you get through the finals. As soon as you get home for vacation, you have a horrible cold or infection because it affects your immune system. And when the hormones go away, that's when we see that it can increase your risk of cancer, heart disease, all of these things sustained stress can do.
And that's the whole fight or flight mode that your body puts itself in to protect you, right? Is that where does that come from? Is it to protect you?
Yeah, it's an evolutionary advance to protect you. But as I said, in prehistoric times, you ran away from something. When the threat was gone, it went away. Nowadays, you're an accountant sitting in an office having that sustained level of adrenaline and cortisol. It causes everything. It disrupts your hormones. Men can have low T. It increases belly fat. Metabolic syndrome puts you at risk for diabetes. It really is something that we need to manage today.
Right. So, as you said, as evolution has changed, how does one take that same fight or flight mode and adapt it in today's world where everything is stress related? I feel like everyone is bogged down with some sort of stress. Obviously, some are more stressful than others, but it's also the way a person deals with it, right? Someone can say, "Oh my God, I'm so stressed out. There's so much traffic and I have to make a nail appointment." And then that for her, she's stressed. And then there's someone else who is working in the ER and has all these patients coming in. So no matter what your issue is, how does one take that stress and channel it into maybe focusing and not feeling that anxiety?
It is, as you said, it's perceived. So if you perceive it as stressful, it's stressful. And a little while back, you asked, what did I learn from the ER? In the ER, we have a system called triage. So that means it's not a first come, first serve, take a ticket, right? Everyone goes through triage and you decide who's the sickest and needs to be seen first. And nowhere is triage more important than mass casualties. And talk about stress with issues with guns today in America. Unfortunately, we see a lot of mass casualties. So, if you're involved in a mass casualty, as many ER doctors are, if you're unfortunate enough to have it happen near your ER and stuff or go in the field, there are you triage the patients, right? And they do that in war too. So there are some patients that are so badly injured, no matter what you do, it's not going to help them. And then there are some patients that are barely injured and they don't really, if you did nothing, they'd be fine. It's the ones in the middle where you can perform an intervention and then you can save your life. And I talk about triaging your stress in the book. And it is true, a lot of these axioms, don't sweat the small stuff. You have to decide. There are some things, no matter what you can do, you're not going to change it. Things in your job, things in this, you can change your job if that's what you decide. But if there's a policy, some things you have to let go. And then there are some things that are minor, and you have to tell yourself, is this going to really make a difference in my life? And then it's the things in the middle that you have control of that you know will make a difference in your life if you address them. And that's how I tell people to address stress. And then there's a whole host. I give them tips to harness it and bring themselves back. It is dear friend who runs the psychology department here at a university had said to me, if you think so, it shall be. And it is true that if you really think something, you have to change your mindset. But the brain is amazing. It's adaptable and you can do it. And there are some techniques you can learn to do it.
Right. I was once reading, I think it was Stephen Covey, he talks about the 90-10 principle, about basically it's just changing your perception, because you can only control what you can yourself, and then it's how you react to everything else around you is what happens. And I think that has a lot to do with it as well, because I can't control the traffic that's in front of me. What I can control is how I handle it while I'm in driving.
And we talk about forgiveness, for example, which is a very difficult thing, but holding in resentment. And there's study after study that people think about, if you feel like you've been wronged, you get angry, you start breathing heavy, all those things are happening. It can cause arrhythmias, it can cause a heart attack. And we have all these studies. So the point is, when you hold in that resentment for someone, it doesn't actually hurt them. It hurts you more than it hurts them. I do think there are some things that just seem not forgivable. And I'm not saying you have to forgive that person, but you have to let yourself let it go for you, not for that person. But those are.
It takes a lot to hold on to grudges and pain. And sometimes letting it go takes some of the burden off.
It does, off of you, right? People that deserve that burden, whether they're in prison or wherever, whatever happened, but it's for you. You have to do it for you.
Now, do you think people are, like, especially women, feel shame about being stressed?
I think I do. And I remember when I was writing the book, Never Let Them See You Sweat. Like, I didn't want to add this to their burden. But the point is, it's the subtitle, How Science Can Help You Harness Stress for Success. And you shouldn't feel shame. You feel how you feel. But now you need to move on and you need to figure out, okay, how can I get past this? Because as we said, getting stuck in this wheel of constant stress and feeling bad and not feeling like you're getting anything done. And then it just becomes this kind of self-fulfilling prophecy, and it tears down your self-esteem and everything else. So you have to figure out a way to manage those feelings. And like I said, even if it's like making a list, sometimes people go to bed and I tell them, look, write out a list of what you think. Don't let it run through your mind while you're trying to fall asleep, because you're not going to fall asleep. And then that adds to stress. So get a piece of paper, write down a list. If you don't get everything done the next day, big deal. Put it on the list for the next day. Triage those things. What really needs to get done today? So I'm hoping that this will give women a chance to give themselves a break. My mother did that for me, and she was my mentor, my best friend, my stress reliever. And I didn't think that since the time I was a little girl that I could live without her. But what I found was her love and support gave me the resilience to go on and be stronger than I thought I could when she died. And I'm hoping that some of the things I learned from her and about medicine and science and studies can do this for other women.
I'm in that same boat as well, because I feel like I take my pain, my grief, my sorrow from Grayson and losing him, to taking all that stress and putting it forward in a positive way, because it actually gives me purpose. And I find that stress is stressful. It's what I need almost to make it to the next day.
And you're turning a tragedy into something positive for other people, which is a blessing.
Now, and in something like this or other tragic stories, how does one take something so horrifying but deal with that stress?
Yeah, you have to, and those stresses take a long time. And I do say in the book when you need extra help and what extra help is out there. And I am a big proponent of that, and not to try and belittle, that at all. But there are some things for other sort of minor stresses or other things in your life, so it doesn't compile. And For example, they say it's true. That's why some of these idioms come about. Laughter is the best medicine. When people are really laughing and joking about something, and it increases your oxygen as you start with a big belly laugh, you can see cortisol levels go down, adrenaline goes down, dopamine gets released in the brain, endorphins. So it is true. Seeing a comedy, laughing with friends, doing that, even in the most dire circumstances. I was talking about my mom's funeral and a situation that happened there that ended up being funny.
Right.
And that we were all laughing. And my mom, I know, would have laughed too. It's always gotten me through a lot, and not taking myself seriously and being able to make fun of myself. Look, this book is, sometimes women say, "Oh, how do you do it all?" I don't do it all. I am neurotic. I overthink everything. I am like, and I want women to know you do. Nobody's perfect and nobody can do it all. So I want to give them the permission to not take themselves seriously. And I talk about some of my epic fails and all kinds of things that I did that were crazy.
Would you like to share some for our listeners?
I'm trying to think of one of the things. I give an example in the book when my husband divorced, and I'm not trying to make light of divorce, but I'm trying to say turning situations around. So I talk about when he just finally took all his stuff and moved out of the house, and he was left so fast that a hanger was swinging in the breeze. And I was watching him drive away. And then I suddenly thought, oh my God. And I ran downstairs and got all my winter clothes up. And I said, finally, I can have both seasons of clothes in the closet. But the truth is, I ended up having a good relationship with him because we have a son. But it was like, it wouldn't have done me any good to sit around and feel sorry for myself. And it's seeing those moments and seizing them and talking about them. And stress relief, like I always tell people, the best investment I ever made when I finally renovated my old master bathroom was a soaking tub, because people talk about blue spaces and green spaces to reduce stress. There's study after study in Sweden about how many parks to put per capita. The Japanese talk about forest bathing, when you just go out in nature. You don't even have to hike or do anything strenuous, even though exercise is good for stress, just being there. And they talk about blue spaces, being near water. For me, having that soaking tub, coming home after a horrible day and whatever, just putting my head sometimes all the way under the water, hearing my heartbeat, slowing down, coming up, slowing my breathing, that I felt like was worth every penny that I spent on the bathroom. So those kind of stress reducing techniques. Being creative is another thing, people can do. People talk about art therapy. And nowadays, you don't have to be an artist, right? They have coloring books for adults.
I have one.
They have Legos for adults, right? Where you're putting little pieces for beautiful, and just taking the time and creating something and taking your mind off of it. Cooking, there's studies that cooking and baking, especially where you're creating something, trying to make it look beautiful, can help reduce stress because you're in the moment there.
I started painting rock.
Right. No, there's all kinds of things like that
Yeah.
that you can do that can relieve your stress
It
and
started
help.
as I paint rocks to bring to Grayson Cemetery,
Yeah.
and I just found it so calming and therapeutic. And now I paint rocks. Who knew?
And and that's a lovely thought and a great thing to do that can calm you down. Exactly. So, those types of things, and it's in the book, suggestions, but also when it's too much and when to get help and how to even triage that help. As a doctor, I'm a big believer in you start at the least invasive. Surgery shouldn't be the first thing you go to. You start with medicines or whatever. So, you starting at the least invasive interventions like talk therapy, cognitive behavioral therapy, because our brain can learn and you can reframe things in your mind. And that's the important part too of reducing stress. That's what triaging is. You're reframing the stress in your mind so that you can handle it better. And then working all the way up to, there's electromagnetic therapy for depression where drugs don't work for people, and you step your way up, least invasive, most invasive.
Got it. So a lot of our listeners are probably dealing with a lot of women related, family related issues, divorce, parenthood, motherhood, custody, family law, definitely all things that are highly stress related. Now, I read something that you said, just doing mindfulness techniques to reframe, like you said, your stress response in real time whenever, they're in a heated argument with their co-parents about the son's something and then they're in the car. What can they do in an instant to calm down?
In an instant, breathing, which then goes back to mindfulness too. And all these little
Yep.
Apple Watches have the breathing. It really does. And they sometimes call it box breathing, where you inhale for 4 seconds, hold it for 4 seconds, then let it out through your mouth for 4 seconds, then take a break. And repeating that cycle actually does switch over your brain from your sympathetic response of flight or fright to your parasympathetic, which we call rest and digest. Because when you're resting or your body's digesting food, it's all parasympathetic nervous
Right.
system functioning. So breathing right in that moment can doing it, and closing your eyes and thinking about where you are and what you're doing and things like that type of mindfulness. Study after study has shown that it does lower your cortisol levels, it lowers your adrenaline levels. Students that did it before tests, there's many studies that looked at students that did it before tests, nursing students, they were able to perform better. So it really can help you with cognitive too.
Yeah, when I was in college, I went to the University of Florida. I took a class called, I think it was called Transcendental
Meditation.
Meditation, and I got an A. So it definitely, I remember just like you close your eyes and you picture yourself like floating on a raft or something, and you throw all your troubles off the raft and you set sail. And it was all these creative ways to
Right. But it works.
breathe.
It definitely.
It did, especially for when I like at night, I can't sleep. I have horrible insomnia. Sometimes I do it on purpose because I don't want to sleep. But I found a technique where you tense every muscle in your body one at a time and then let it go,
Right.
which I found to be pretty interesting.
Yeah, no, absolutely. It does. It works. And it's a form of mindfulness and meditation. So those are also very helpful. And being in the present too. Like you can have a situation happen that's scary, and then your mind says, and then this is going to happen, and that's going to happen, and this is going to happen, instead of just saying, or I have so much to do, and then I'm not going to get this done and this done, instead of saying, okay, I'm here right now. Okay, this is where I have to be. Let's just focus on this one thing, and then I'll worry about that. Every 1,000-foot-mile journey begins with the first step. So it's keeping yourself in the present too, to say, I'm just dealing with this. Let's not think about the 20 other things that maybe it could impact right now.
So, as you say in your book, how exactly does science help in these creative ways, or how does it link back to science?
Because what I do in the book, there's probably 1,000 references, if you care to delve into the clinical trials, that really show these techniques can make a difference. So I didn't want the book come across, oh, this is just me saying this and this is what I do. I wanted to show women that, look, this is what I'm saying that's worked. I've done the research for you. These are the studies that show that it works. And all of these things, like laughter, singing, humming, it's hard to be anxious and mad when you're singing a song or humming.
True.
I had a colleague when I was on faculty at the University of Maryland School of Medicine who did a study and showed if you listen to music that you love, it could be something that someone else wouldn't, but something that you love. He did ultrasounds and found that it opens your blood vessels. You get more flow to your brain, more flow to your heart, more flow. So these things really do work. And I show people with the thousands of studies that were done. So just as to say, give it a try.
Yeah, no, I guess it makes sense when you think about, you said your cortisol rises when you laugh. And I guess that also applies to sexual encounters and
Yeah.
whatnot.
No, relaxation. It's hard. Men probably have more performance anxiety than women, but women too.
Right.
Sex is all in our head a lot of times. So you have to get stuff out of your head. But yeah, there are studies that show decreases cortisol, increases oxytocin, the cuddle hormone, increases dopamine release. But you have to get past that. And if it takes some mindfulness and meditation and trying to say, okay, I'm not going to worry about this right now. I'm going to be in the moment with what's happening now, and it'll still be there later. And it probably won't be worse. It's all about reframing but giving yourself a break too. I don't want women to say, I should be perfect. I should be able to handle it. No, the whole point of this book too is that, yeah, everybody's going through this and it's hard and you just have to don't give yourself some grace and some room. People make mistakes. Nobody's perfect. And no, you're never going to be stress free. We have inevitable stresses all when you're dead, you're stress free. But other than that, it's just part of life, but trying to manage it. But you're not perfect. Don't be upset if you can't manage it that every single time.
Yeah, I always say everyone fakes it till they make it. Nobody is perfect.
Right.
We all just take things as they come. So
Right.
I read that you talk about the idea of stress inoculation. Can you explain what that is?
It's more like resilience or just small doses of stresses. As I said, if you're triaging your stress and you're these little stresses that you know aren't going to make a difference in your life. Someone rushes past you on the highway and cuts you off. Okay. Hopefully you didn't have an accident. Stop. You're about to ready to honk your horn, give them the finger, do something. But if you check yourself and say, really, what does this really mean to me? This guy's an idiot. He's probably going to get in an accident and hurt himself, hopefully not anyone else. And letting those little things go. As you start to not sweat the small stuff, over time, you realize that even some bigger and bigger things you can manage that way. So it's a kind of a form of a resilience. And by triaging things and deciding this is not worth it. My mom always used to joke when I would be worried about something. She'd be like, Leigh, is this worth having a heart attack or getting cancer over? And it's so true. And she was
Yeah.
not a medical person,
No,
but
I get that.
that's the truth because it is true. Stress, it can affect your immune system. Our immune system is constantly surveying our bodies for abnormal growths and cells. And if it's dysfunctional, it can miss it. So there is an association with increased chronic stress and cancer spread in patients that are receiving surgery, non-response to surgery.
I know. I used to be a server and a bartender in a restaurant, and I would get so stressed out by the end of my shift, and I'd be like, I'd have to check myself and be like, I'm serving food. Like I'm not an ER doctor. I'm not a surgeon. Like why am I so stressed out by waiting on people? And so I'd have to do like a reality check and be like, okay, it's cool. I'm cool.
And women tend to be people pleasers, right? That's what we do. So learning to advocate for yourself and learning that sometimes you're not going to be able to please everyone, no matter what you do. You could have do bend over backwards for a customer and it might not make a difference. So those are things you got to just let it go.
Now I have a question like do children get stressed? How is it different with children?
Kids, there's just so many stresses with kids. Kids are very resilient, which is true, but they take their cues from their parents if they're living in
Right.
houses with
Yes.
parents. There are such societal issues with kids and stress. There are some that live in food deserts. There are some that, live in single family homes that are indigent, and it really depends. But a lot of kids take cues from their parents too. But talking with them, especially they see things on the news sometimes, and you almost have to see how they react to it.
Right.
And seeing adults get upset. And there's a lot of upsetting media now out with kids being picked up and deportations and these kids. So there are some horrible stresses for kids. And look at kids
Sure.
in war-torn regions, right? So those extremes, obviously, they need help. But for minor stresses and your child going to school or whatever, it helps to talk to them and they mimic what we mimic. So if you're getting stressed about things, they will be stressed. So you have to check yourself. We'll do everything for our kids, right? So that's another thing you can tell yourself to check
Well, what
yourself.
are some tips we can give our kids to help them deal with stress? Like
Well,
I used to tell Gray, say 5, 4, 3, 2, 1, and then regroup.
and take a deep breath. And even when your kids get older, I have a son in graduate school now, and when he gets stressed about stuff, I find, because as a parent, we want to fix everything, and he would just get angrier with me. Plus, what do I know about a PhD in physics? Nothing that I can offer useful. So now I have to say, even when he calls as an older, okay, do you want my advice? Do you want me to listen? And it's usually no, he just wants me to listen and vent. So giving your kids a chance to vent as they get older, they are supposed to be more independent. You can't necessarily fix everything for them. Don't try and fix everything. Just listen, give them a sounding board. And then if they want advice, helping them regroup their stress the same way. And I agree with little children, they get so mad. You ask them, why are you mad? What are you afraid of? What can we do? Okay, let's take, like you said, a break. Let's take a break. Let's close our eyes. Let's take a deep breath and then think about it. Okay, and try and let it go. So helping them with some of those things can often help too.
Okay, great. Now, what if some people take their stress and they actually turn to maybe alcohol or drugs or coping mechanisms to deal with it or bury it? What are some ways to get around that so you don't do that? And is there any medication maybe that you do recommend, like Xanax?
So there are certain times where you absolutely maybe need some intervention for severe stress, severe anxiety. That's what I said. This book can give you tips, but there is a point and when it's so severe and what you need to look for, signs of severe depression. I talk about that. But you're right. You turning to something else like alcohol, you need to talk to a physician about that because that isn't a really great coping mechanism. Same thing with opioids and drugs. They're not that great. There are short terms where a Xanax, something awful happens and you need sleep for a couple days and you need to, there are short term, but once it becomes more of a long term thing, you probably do need help. There are, for opioids, there are medicines now that even in the ER, they can start for people that really want to stop. But those people also have to want to stop too. It's like very hard to do an intervention, but it's a disease. We have to understand alcohol use and abuse and alcoholism is a medical disease. So is opioid dependence. And these are things that need treatment. And there are medicines for that, but you need to be in a good treatment program for that. But trying not to turn to it initially all the time is something that's important.
And do people do that just numb themselves from dealing with
Yeah,
the stress?
they do. And it's hard. So turning to support systems, family, close friends, siblings, anyone that can support you for that. And like I said, there are some things that sometimes a doctor will say, yeah, I'm going to give you Xanax for a while. But I think most doctors now know this is just for the short term. Let's help you get over this tragedy for a short time. Then maybe you need some counseling with it. And then, antidepressants, as opposed to, there are some antidepressants and that also have anti-anxiety. And that's probably better than Xanax. They're a little bit less addictive and they can help manage anxiety and numb a little bit of what, just blunting the pain and things like that.
Now, where does cannabis fit into that?
So it's interesting because, and I talk about it in the book too. So we have this internal endocannabinoid system.
Okay.
That's the reason we respond to the plant cannabis. But our own body, in times of stress, releases our own internal endocannabinoids, okay? All different things. For example, in seizures and stuff, when people have a seizure, it's the constant firing in the brain. While our endocannabinoid system is a modulator of what's going on in the brain. And there are conditions that people have surmised. Dr. Ethan Russo is great researcher. He talked about clinical endocannabinoid deficiency, meaning where some people have these conditions like irritable bowel syndrome or fibromyalgia, things that we don't have good medical treatment and reasoning for. Maybe they have a dysfunction of their endocannabinoid system. But when you take plant cannabis, it does attach to those receptors in the brain and throughout the body, and it gives similar effects. THC, there's a whole bunch of cannabinoids, but the most common that we know are THC and CBD. And there have been studies that it can blunt anxiety and depression. What's interesting is THC at lower doses can be anxiolytic, anti-anxiety, and sometimes at very high doses, especially for
Right.
people that have never taken it, can cause some paranoia and anxiety.
Got it.
CBD, there's been studies with CBD using it for social anxiety and things like that. But I also recommend that you don't do it on your own, even though there are a lot of states now that have.
Right. Medical.
There's medical cannabis, but they have adult use legal
Right.
cannabis. A lot of
Sure.
states, Maryland's one,
Colorado.
New York, Colorado, right. So you really don't have to see a doctor to do it. But my recommendation is to see someone who's familiar with it or talk to your own doctor when you first start, because you should start very low and slow. And I had given patients actual recommendations of how to dose and what to do. And there's ratios, like maybe higher ratio of THC at night to help you sleep a little bit, and then CBD more in the daytime. So you should talk to an expert if you're medicating yourself for it, if you're not just doing it for recreational or fun. So if you think you need it, but it's been useful. I've seen patients that have treated some of their anxiety with
Right.
CBD.
So for someone like me, it could go either way. It's hit or miss. Sometimes I will totally chill out and feel good and relaxed. And sometimes I'll get super paranoid and start thinking really dark things. And with my grief and everything, what do you say a good ratio would be for someone for me that maybe just wants to control anxiety or go to sleep?
Yeah, I would say that probably something that is more CBD dominant for anxiety. There are CBD products out there that are over the counter, meaning you don't need a recommendation from a doctor if you're only a medical state, that is. But they have full spectrum. So that what makes it hemp is 0.3% THC in there. So it has a little bit of it, and you can take that for anxiety. I've even had some patients that say they take it at night. CBD in lower doses can be more awakening. If you take a higher dose in the evening, it can actually make you a little bit sleepy. For people, and I always say to patients they should have a range of stuff. I don't believe in smoking, but there is vaping that can give you immediate, even like for all day pain, all day chronic pain, you need to have something you can vape for breakthrough pain, but then you need something that lasts longer, like a gummy, which can last much longer, or tinctures under your tongue. But finding a knowledgeable doctor about it. And the other thing is making sure that you're getting something reputable. There are some very reputable CBD companies that are out there that give you what's called a certificate of analysis. So you can see there's it has what percentage is CBD, what percentage is THC, are there other cannabinoids, are there terpenes, because some terpenes can help you relax too.
Is that what we say the
Like,
strains are, like indica and
you know what, it
sativa?
used to be in the old days the strains were different, but now the
Right.
strains don't mean as much. So
Okay.
if you went to a real medical cannabis doctor, they would talk about THC dominant, CBD dominant, or a 1-to-1 ratio. There are prescription drugs. In the US, there's the prescription of Epidiolex, which is an isolate of just CBD, nothing else in it except some artificial colors and flavors. And then they used it for seizures with kids. But then there's some in Europe, there's Sativex, which is a 1-to-1 spray in your mouth of THC and CBD. And I would always start someone more on the CBD side first if they're naive to cannabis. But if you get a reputable company and you know how much it is and you can check from time to time, that's why even patients that use it for treatment, sometimes they say this month, this lot seemed not to work as well, because that's why in the drug industry, they switched to synthetic drugs, because you could control exactly how much. This is a plant, it's not a factory. One condition could be a little different when the plant was growing, and when they process it, they don't get the exact same. So It's an interesting branch sort of medicine because it's very individualized. People have to tinker around themselves, but it helps to have a knowledgeable physician that can help you.
And it's very taboo. Some people are just like, no, it's a drug. I can't take that. But as we've all seen, alcohol is also a drug. But it's legal. And I feel cannabis, pot, whatever, is probably a lot less diabolical than alcohol.
But definitely, if you look at the number of deaths from tobacco, look at the number of deaths from alcohol, there's no question that there's no comparison as far as like number of deaths from cannabis. Really not.
Well, and it serves a purpose medically, correct? It helps with nausea, it helps with anxiety. What are some others?
It can help with anxiety, depression, chronic pain. They're doing research with spasticity. Every cell virtually in our body does respond to cannabinoid, has cannabinoid receptors. Cannabinoid receptors and the endocannabinoid system is so ingrained in our evolution that animals as low as sea squirts have cannabinoid receptors. Any animals that have a nervous system, they have these receptors because it helps modulate the nervous system. So every function in our body, it can put the brakes on things. It can calm you. Our immune system, our nervous system, our cardiothoracic. So it's really a part, the endocannabinoid system is really a part of our physiology. And that's why people respond to.
Very interesting.
Cannabis.
How did you get into that?
It was funny. I was on faculty at the University of Maryland School of Pharmacy, and I was talking to a colleague who had just got his paper accepted, and I had been practicing for probably 15, 20 years then. And he just got his paper accepted for the level of endocannabinoids in stressed rats. And I was like, what word is that? Like, I'd never heard that word before.
I think I can say it.
Cannabinoid? I mean, I said, we have internal like endorphins, which are he goes, yeah. I go, why are they not teaching that in medical school? And they still don't teach it that much now. And that was like, I don't know, 20 years ago. And not quite 20, but I was just shocked. So I started reading everything I could. And then Maryland had their first course, the School of Pharmacy, on it. And I wanted to learn more. And that's how I did it. It's one of those things, too, that I talk about in the book, that I changed direction. Like, I consider myself a lifelong learner. So I like to do new things and try new opportunities. Some are jobs, like using my medical degree to do other things. And that's why I don't want women to feel stuck, especially if they're not in a good situation. It's like learning that resilience and dealing with stuff. I talk about try something that you suck at, right? Who cares if you're not good at it right away? If it's something you're interested in and you want to do it.
Right. Now, how does one take their stressors and use it as something motivating or put it to good use?
Like I said, in certain situations, it can be a friend, not a foe, because that's what keeps you sharp before you're going to give a presentation. Like I even talk about when you were asking before, the stress inoculation, like public speaking. People are afraid to do public speaking. There's all kinds of clubs, Toastmasters. That's a way where you're going to be nervous. You're going to say your first speech. You're going to do whatever. But once you've done it and you're successful, it's like you've taken that stress and that fear of public speaking. You've done something with it. You've tried something new. All of those things build on your self-esteem so that the next time you're in a stressful situation, you feel like you can do it. So that's sort of part of it. Picking out a situation where you know a little bit of anxiety and stress is really going to keep you on your toes. And then once you accomplish that, you feel better.
Yeah. And I was about to say, and when it's done, you're like, it's like a sigh of relief and you feel like a weight lifted off you, which is like working out.
Yeah. When I was started in urology and had to do 2 years of general surgery, which I don't think urologists do anymore. And I was in the ER and we would take trauma codes on certain days. And I remember one of my chief residents who was a 5th year in surgery ready to go out. And we were in the city of Detroit Receiving Hospital, which was like the #1 trauma center, probably one of the top in the country too. And we would see the most atrocious trauma come in. And after you got these people to the OR and you actually helped fix them, I remember my senior resident in trauma was like, yeah, bring him in, decapitated. I think I could get his head back on. You get that feeling you've gone through the stress and the trauma. The surgeons are too trying to save this life. I know people watch a lot of shows like ER and the Pit used to be, and it is like that in a trauma code. Everyone comes together and does things. So anyway, but then you get this feeling like, hey, I can do anything, which of course, obviously, if someone comes in decapitated, you cannot fix that. But I just remember him saying that one night when we were sitting around talking after a couple bad trauma codes.
Well, it's very interesting how you mention all your TV appearances and hosting and all your medical analysts and whatnot. How do you feel, I guess, obviously it's very different working in a hospital setting than it is to give medical advice on television. But I guess how did you take that experience and bring it to everyday issues on TV?
I think in the beginning in ER, and I do tell people that emergency medicine is a young person's sport, and you get to a certain age and you're
Right.
like, oh my. But, and I've worked in industry and done other things. I always felt like you were taking care of one person at a time and you saw them in crisis. And a lot of times it was too late. It wasn't a chance to practice preventative medicine as an emergency physician, because these were patients that stopped taking their insulin or didn't pay attention to their diet and did all these things and came in diabetic ketoacidosis and all these things. And it could be a teachable moment at that time. But by able to, I used to say I can treat one patient at a time in the ER, but when I write or talk about medicine, I can affect a community wide thing.
A
But,
broad
a
range, yeah.
lot different. Yeah. And it's a lot different now than when I started and there was just traditional TV and there wasn't social media and there wasn't all these things, because you do have to beware. I've written about and talked about, even on the internet, how to know that this is a trusted medical source, to pay attention to the advice you're getting versus some influencer that just, this is their idea. And that was also why I wanted to have all those references in the book and say, hey, this is the science that supports what I'm saying.
Were there any like behind the scenes moments from your TV work that viewers would find surprising?
I had wanted to do it. I always used to joke that it was harder to get on television, and I started local TV in Baltimore than it was to get into medical school. It was just crazy.
Right.
And then the very first time I did it, when they put me in as a morning like report about it, they would put stuff, I would send notes to the producer about what we were going to talk about, and then he'd put it in the prompter, and I was there trying to read and I thought, here I am in my head, I'm saying, here I am doing this, and I'm reading the prompter and stumbling and acting like an idiot, and this is what I wanted to do, and now I really suck at it. And the producer came up later, he said, Leigh, what were you doing? Those were just flashpoints for you to go off and talk. Just pay attention. You know this. Nobody else knows this. You're the doctor. And it was from that point I said, yeah, I need to just trust myself and just talk to the anchor. And then that was for her to ask questions. And
You need some positive stress relieving techniques in order to read a prompter.
Yeah, no. And when you're trying to not look like a deer in the headlights, which I did that the first few times. And then I was like, yeah, forget it. Don't even put the notes up there. We'll just talk.
That's great. So I guess where can one get your book?
It's at Barnes and Nobles, or it's at
Amazon.
Amazon and some local, but actually the book is coming out July 12th. So it's
July 12th. Okay.
Yeah, July 12th is when the release date is.
Got it. Okay. So for our listeners, if you want to just give any last tips for dealing with their stress or any words of wisdom.
Yeah, give yourself a break for sure. Everybody has stress. Nobody navigates it perfectly.
Don't get stressed about stress.
Yeah, don't get stressed about your stress, and try and find some techniques that work for you. Not everything works for everybody, and find some techniques that you like that work for you.
So
And
I say like breathing.
One, exercise, getting outside in nature, doing something creative where you feel like you've accomplished something and had fun doing it.
Yeah, those are all great tips. I know for me personally, after my son passed away, nature, which I've never been like a nature girl, like hiking or whatever, but just being outside and being by the ocean or in the mountains was spiritual and it was enlightening.
Yeah,
So
it
I
really
agree with
is.
all that. I thank you so much for chatting with us today. I think our listeners and myself has learned so much, and I will try my best not to get stressed by my stress although it is hard. With reading books like yours and practicing all the techniques that you shared, I feel confident that we as a nation, as people, can effectively harness our stress into positive things and positivity in general. So thank you so much for talking with us.
Thank you for having me, Allie.
Absolutely. And we hope to have you back because I'm sure we will have a lot of questions.
Absolutely.
All right, we'll talk soon. If there's someone that you want to hear from on this podcast, please feel free to send me an email. Or if you would like to be a guest, please reach out at Allie@graysonschoice.org.